Good morning, friends. Today we are meeting to continue our discussion about the materials that are used for the implant crowns. So basically we use three materials for the implant crowns. That is, first one will be zirconia, second one will be metal fused to ceramic, and third one will be the resin. So the first option for any dental implant crowns will be zirconia, because zirconia creates highly aesthetic crowns or the tooth, and we can create the natural tooth-like appearances with the zirconia. Highly preferred for the front tooth implants or the front tooth caps. So many times we can, for the posterior teeth, we prefer zirconia and also the metal fused to ceramic, because sometimes the zirconia can be brittle, and in the high occlusal forces, when we do the screw retained implant processes, chances of the marginal fracture can be high in case of zirconia. But still we can place very good zirconia caps for even front teeth and also for the back tooth implant crowns. Coming back to the second one, that is metal with ceramic. Usually we prefer this metal with ceramic for the back teeth, because it can sustain the high occlusal forces. Metal with ceramic contains the ceramic as a layer which creates the natural tooth-like appearances, and below that available will be the metal layer to give the strength to the ceramic. Zirconia does not need a metal layer because it has got its own strength because of the minerals which are incorporated in the zirconia, but the ceramic needs a metal layer for the strength. So that's why we call it as metal ceramic or porcelain fused to metal. These two are very good options for the fixed prostheses. So usually we call it as implant supported fixed prostheses or implant supported fixed partial dentures. Third option will be whenever the height of the crowns or the bone loss is more, then when we need to increase the height of the prosthesis, the bulk of the zirconia or the ceramic or the metal ceramic can be more. At that time, usually we use something called as hybrid prosthesis. So what is this hybrid prosthesis? A metal layer will be there as a substructure, as a skeleton. Over that we use the acrylic resin to build up the core and also the teeth. So here in hybrid dentures, patient will be getting the metal as a substructure, as a skeleton, and over that the acrylic resin and resin teeth will be available. This we call it as hybrid denture. Again, friends, what we need to understand is all these three are fixed options. That means patient need not have to remove this daily. So either we go with zirconia or metal ceramic or even the hybrid denture, no need to remove it. And the fourth option will be the entire acrylic dentures. Here what we need to understand here, the base will be acrylic and teeth also will be acrylic. Whenever we are using denture on the implant, we call it as implant overdentures. In the implant overdenture, it can be supported with more implants or the less number of implants also, where the support will be derived from the tissues or the gums which is available. So as a material aspect, out of all these four, what we need to understand is only the last one, that is the acrylic dentures, only is used as removable. Here the patient should be able to remove the denture and clean it on a daily basis or on a regular basis. This denture, which is removable, should never be fixed onto the implant. This is very, very important concept, because it contains the extended flanges or the flange means the area which is covering the gums also. And if the removable dentures are fixed onto the implant, then the oral hygiene maintenance will be very difficult. Other three concepts here, what is the advantage here is in the First one is the metal ceramic and second is the zirconia, where the flange extension will be very minimum or it will not be there. At that time, it will be looking like a natural tooth. So it will be completely fixed onto the implants. So patient need not have to remove the prosthesis and they can use it as a natural tooth. Coming to the hybrid denture, flange extension will be more in hybrid dentures, but whenever the food accumulation or any issue is there, that can be easily removed by the dentist or an implantologist and it can be cleaned on a regular basis, like 3 months or 6 months, or on the regular follow-up it can be cleaned. The fourth option what I was trying to tell you is the conventional dentures should never be fixed onto the implants where it cannot be removed either by the dentist or by the patient. This is very important concept which you need to understand when you are undergoing any dental implant procedure. So as a summary, highly aesthetic crowns can be created by zirconia. So whenever you are getting for the cap or the crown for any implants, always prefer zirconia, especially for the front teeth. When it is back tooth, you can prefer either zirconia or metal ceramic caps, not a problem, or the crowns. The third option is the hybrid dentures are not as a first choice, but whenever the bulk of the prosthesis is increasing, whenever we are doing the full mouth oral rehabilitation, at that time the vertical dimension is too high. At that time we can go for this hybrid dentures, but it is not removable by the patient but removable by the dentist. Fourth option and the least preferred will be implant overdentures, because the material will be acrylic resin, it cannot bear the occlusal forces like the metal ceramic or the zirconia crowns. Here, as I told you, it should be removable by the patient on a daily basis and it should be cleaned, and the removable denture should never be fixed in such a way that it is not removable by the dentist or even by the patient also. Any query regarding this, kindly feel free to contact toothpriority.com, and any implant treatment is required, you can definitely contact us. Thank you.